The hospital started its services in the heart of Kunduz province in January 2011. It is equipped with very modern medical equipment as well as highly experienced physicians in internal medicine, gynecology, pediatrics, laboratory, ultrasound, ECG, surgery, and X-ray services. An average of 50 or more patients attending the hospital on a daily basis, serving in various aspects such as general checkups, maternity and obstetrics, pediatrics, lab, and radiology, with 20-hour service for 10 inpatient beds. The hospital started services in January 2011, 24 hours a day, 7 days a week. The services include internal medicine, maternity, pediatrics, diagnostic services such as lab, ECG, and radiology equipment, with 10 inpatient beds.
In general, what predominant health-related issues are people of the region facing?
The communities of the region are facing an enormous number of difficulties in all walks of life, specifically in health-related issues.
Are the people of the region capable of affording the expenses of health-related bills?
The people of the region have suffered over a period of 3 decades. In many aspects, especially economically, hardships are very tangible, and so they are unable to pay for the medical costs.
At what capacity can Falah offer its services?
Falah services are aimed at underserved populations of the region within its capacity. On one hand, the general hospital is overloaded with patients and the need for more health services is urgently required. Therefore, Falah will play an important role in filling the shortage. And on the other hand, the private clinics are very costly and not affordable for the underserved populations of the region. Falah plays a more significant role in offering services for those who are unable to afford the high fees. In short, Falah has a significant optimum role to take care of patients in the region.
What is the real significant impact of Falah services on the people who live in the region?
Falah has adopted a moderate policy in terms of affordability. The adopted policy is based on the philosophy of sliding scale fees. It is neither free nor does it make it unaffordable to pay the fees.
Can you elaborate more in terms of fees in comparison with other private clinics in the region?
Falah needs to gain sustainability in the near future. Therefore, we need to impose some small charges to cover our costs. We offer people a 50% discount over what other clinics charge. As I mentioned about the sliding fees, in some instances, we charge patients only 30 or 40%. This is based on the financial state of the patients.
What are the main challenges you experience at the state?
The main challenge is our non-standard building for a hospital and its inadequate space. We have a great influx of patients on a daily basis, and we are unable to accommodate them sufficiently. Thus, we need to have a larger facility, more equipped with very advanced medical equipment and accommodations for at least 50 hospital beds.
What suggestion do you have for the improvement of your services?
I'd like to see improvement in terms of obtaining, firstly, a standard hospital building with all the facilities to accommodate all the necessary wards, labs, and other equipment we need. Second, a much larger space to respond to the needs for at least 50 inpatient beds. And third, some advanced medical equipment for the lab and radiology. So then we'd be in the position to have an in-depth analysis, diagnosis, and provide results.
Is there a message you wish to convey to the viewers?
I ask the people to experience our services so that they can see how prepared we are, along with the quality of service that we have, and to see the effort we put into our daily duty to make you feel comfortable and confident in our services. There are specific areas and wards that have been designated for patients related to their related problems, so that the patient and whoever is accompanying them can go directly to the relevant department. The administrator of Falah, Dr. Isa Tawhidi, says, "We have a very competent and experienced receptionist to direct the patient to the right ward after talking to the patient about their medical needs. The patient will be issued a permit, a tag, after paying the necessary fees." This system of managing a huge influx of patients has been practiced since the establishment of the hospital, and it works very efficiently in saving time and avoiding unnecessary wait times for the patients. Although the hospital has very good medical equipment, I would like to see more advanced medical equipment and labs to serve the community in the best possible way. I am very happy with our team for the service we offer, but I would like to see improvements on a daily basis so that we can provide better quality service for our patients and the local community. My name is Abdul Latif. I graduated from Razanfar Institute of Kabul, and I am currently serving Kunduz people through Falah Hospital. I am conducting very important tests such as urine, biochemical, and blood. The area used for the lab is not big enough and requires a larger space with more sophisticated lab equipment. This way we can provide a better, accurate, and deeper analysis. We need to expand this facility as soon as we can. Falah medical staff are hoping to have permanent services for children, but for the time being it can only provide outpatient services. Dr. Zamari Warad says, I assist newborn babies if they have any problems, in addition to those children coming as outpatients. The main focus in Falah is on maternity-related issues, but in addition, I am in charge of pediatrics. The noble people of Kunduz enjoy optimum services for their children. I take care of 10 to 20 children per day, and those who need to be hospitalized are referred to the General Hospital of Kunduz. I am very enthusiastic for the expansion of the current health project, and hope that soon, in the near future, we can open many necessary wards for our children. Malnutrition is the major concern for children, and this needs to be addressed and is of the utmost importance to integrate into Falah services. This baby is only 2 days old and was born without an anal opening. I had to call the surgeon to perform corrective surgery, and the problem was taken care of immediately. But he still has a birth defect in his left foot and needs to go on to see an orthopedic specialist. Dr. Razia Akbari, gynecologist and ultrasound specialist. She is very pleased to have access to a very advanced ultrasound machine, but she shows concerns with space limitations. Dr. Razia says she receives 10 to 15 patients per day.
I need to have more training for the ultrasound machine, since the machine has many other important features which I need to become familiar with. I need to become familiar with these features so that I will be able to use the equipment to its full capacity. The building is not large enough to accommodate all our immediate needs. Thus, I hope to have a larger space to meet the demands of the community. I am in charge of maternity and obstetrics and receive 2 to 3 maternal issues on a daily basis. We had 1,420 patients in the last 2 months with the following related issues. 70 patients gave birth, 5 needed C-sections, 10 cordage patients, and 20 patients with maternal-related issues. The fees are very affordable for the underserved population of the region. The capacity of the hospital is very limited due to the lack of space. We offer a 24/7 service, and midwives are always on duty as well as outpatient services.
Falah is created to offer reliable, affordable, and safe services to the people of Kunduz. Therefore, people express their gratitude and thanks, and people feel confident to use the services and hope for further expansion of the project. I've come with my family to the hospital, and the fees are very affordable, and the staff are very friendly and treat us nice. My name is Aghra, and I live in Khan Abad. I'm a shopkeeper and have been here twice so far. The hospital is very clean, well equipped, and waiting time is minimal, and everyone is nice. The results of their treatment is very positive and satisfactory. Therefore, I have come for a second time to obtain their services. We are all very pleased with what they offer us in kindness. I'd like to ask everybody to support this hospital in whichever way they can, and I hope for the expansion of the project to accommodate more people in need. I brought 2 patients to this hospital. One was diagnosed and prescribed medication, and the results are very satisfactory. The doctors are treating us with kindness, and the fees are very affordable. Are you happy with all the services? Certainly. I'm very pleased, and the proof of my happiness comes from the fact that I have come from a very long distance to obtain these great services.